So meanwhile, all the participants, they are all social work students from bachelor's and master's?
Yes, we have kept this open, and we have the people who are interested to know about social work. So the audience is not just from the college. We have the participants from Pan India.
I see. Okay.
Sorry, it's taking a little time.
No worries. I'll just begin, and once the slide is ready, you can just present. That's fine. So welcome everybody. As Dr. Richie mentioned, my name is Praveen. I'm from South India. I originally from Kerala, but I did my master's in social work from Jnana Bharati, the Bangalore University. Then I worked a few years in Bangalore, primarily in HIV care and support programs with major organizations involved in HIV care and support program. Then I immigrated to Canada. In between, I went to UK for a while, did my cultural exchange program to gain the international experience. I will also mention about that opportunity. That was my stepping stone to my international experience. So that's a very important piece of information I like to share as well. And last 14 years, I'm in Canada, and I practice my social work here. Primarily in medical social work. I'll speak about that. What's the role of a social worker in a hospital setting, and how the system work here, and what are the policies, and how we support the individuals and families over here. Okay. So
I suppose the presentation is visible now to everybody. Yes.
Oh yeah.
Okay. Thank you.
Can you go to the second slide? Yeah, I just want to talk about three key organizations. One is a regulatory body, and one is licensing body, and one is, the agency prepare the curriculum and approve the curriculum for social work masters and social work students. So these are the very key organizations. One is called the Canadian Association of Social Workers, and the second one is because I'm in Ontario province, that's why I picked up one of the regulatory body in Ontario province. That's the Ontario College of Social Work and Social Service Workers. That's the agency give us a license to practice. And CASWE, Canadian Association for Social Work Education, this body overlook the syllabus and also work with the universities to implement the curriculum is updated, and they are meeting the criteria for education. That's a regulatory body. You can go to third slide. So these are the three major organizations you have to look up. And in this presentation, I just want to briefly touch about an overview of social work practice in Canada. There are various sectors social worker practice here in Canada, and provincial wide, because we have many provinces. So each province, the standard of practice different. Regulatory issues are there. So if you go to a different province, I live in Ontario province, regulations are there, and we follow the college regulations, Ontario College of Social Work and Social Service Workers. Likewise, other provinces, they do have own regulations to give you the license. Means in Ontario province, I don't have to write the exam to get the license, but other provinces, they have to undergo the exams in order to get the license. And also there are future legislations. We need to follow the legislations pertaining social work practice when you deal with the client or do the community service. We have to follow that. And also I'll just brief about role of a social worker in various sectors, like as a child welfare or a psychiatric social worker or a medical social worker, or what are the various roles and what are the skill sets primarily they look into in order to practice as a social work in Canada. Okay, can go to the next slide. And as usual, the social work education same in India and Canada. So it's a theoretical course and practical training. And also here, bachelors, in order to do the masters in social work here, they have to complete a bachelor's. So it's minimum of 4 years. If they do continue education, then they can complete bachelor's and masters in 5-year term. Okay, so that's an advantage of continuing education, bachelor's and master's back to back. And also, those who have degree in another discipline, they have to do the 2 years program. For example, they have sociology or psychology or other bachelors, then they have to do a full-time course in order to get the master's in social work. But if you have a bachelor's, then you have to do only 1 year because that will compensate. You can go to the next slide. So that's basically 4 years plus 1 year. That's 5 years. You can complete your bachelor's and master's in social work if you are planning to study in Canada. I think in India, it's 3 years of bachelor's and 2 years of master's, right? 3 plus 2, 5 years?
Right, sir, right.
Okay. So these are some of the universities in Canada. They offer social work courses, masters, and also they do offer a bachelor's in the same universities. Also, a lot of international students coming here, basically for diploma courses. So like there are 2 years diploma courses available. They can come after high school, after 12. They apply for the international study permit. Basically, social service workers working with the seniors or working with the addiction and mental health sector. But that's basic diploma courses. Career advancement is very low in those courses because they look into an opportunity to come to the Canada. That's it. But those who have a background in Bachelor of Social Work or Masters and they're coming over continuous education and also looking into social work career in Canada, that's the best strategy to go on. But I less encourage over after grade 12 just coming for a social service diploma courses because there's employment opportunities are there, but they make less amount, and also there is no professional growth. There is no career prospects in those courses. In order to survive, you need to have a professional degree like Bachelor of Social Work or Masters. That is recommended because those 2 degrees have a lot of scope to practice and they can earn more and they can obtain the professional practice license. You can work in a hospital setting, you can work in government sector, or you can open up your own practice. So there's various opportunities if you have a professional qualification. But those who with the diploma 2 year, so there is no way they can practice self, and they have to employ some of the agencies, those who do home care or those who do day programs for seniors. Kind of that's a basic. There is no professional growth in nutshell. That's the point. And you can go to the next slide. This presentation will be a little theoretical perspective. That's why, but I just want to explain review so that you can have an idea. Those who are aspiring to migrate to any other countries, especially in Canada, this would be a great information. And just want to mention social work practice in Canada. It's a regulated profession. It means you need a license in order to practice. Otherwise, you cannot practice like meet the clients or do counseling or assessment or interventions. Without license, we cannot do anything. So that's the first step. It's a regulated profession. We have to obtain the license, like license to drive the car or motorbike. Same thing. So we have to obtain the license. And the approach is more client-centered and evidence-based. So we have the best practices. The institution, when we work with the seniors or rehabilitation patients or palliative care or other populations, they give us the guidelines or the best practices and assessment forms, and we'll get the orientation about applicable policies. So we are well aware about it. And all the interventions is client-centered, means we give the preference to the client. But in India, it's a little bit different. When I was in India, I completed master's in 2006. I practiced a few years there, but it's basically as a family, we make the decisions. It's not really client-centered, but here it's more client-centered if we need to take the directions from the client. For example, when we do the intake or the psychosocial assessment, And the client, whoever it is, if they say, oh, I don't want to disclose my personal or health information to my wife or my children or my parents of so then if the client verbalizes that way, then we cannot disclose any information. That's the consent restriction. So then even wife or family come and ask, oh, what's going on with this patient and what he's telling? Unfortunately, we say we don't have any consent to explain or review his personal or health information or any treatment plans with you because he mentioned do not disclose. So we put the consent restrictions in place and we go based on the individual. That's a major difference when we practice in India and Canada, maybe other countries as well. It's all client-centered. Whatever directions client give to us, we follow. And that's called, we need to obtain the consent. In that consent, we will ask always, am I allowed to share any information with your family, wife or children or parents? If most of them say yes, but still we have to ask and document it. And if they say any restrictions, then we cannot. And even police or other department come in to inquire, so we are not legally bounded to disclose any information to them. We can redirect to our personal health information department. You go and obtain from there. So we don't really disclose any information as per the policy. So we can redirect to our concerned department, police or anybody. They have to go and obtain from there. So we are not supposed to disclose any information unless it's a joint case and implied consent in place. There are some conditions in place, but generally, no. So we don't disclose any information unless we have a consent in place. And other principles, we follow dignity and worth of the person. Likewise in India, so we follow the same and anti-oppressive lens in all areas of practice. And also the assessment, if you practice here in Canada, when the organizations, they give us assessment forms. So it's a well-defined forms. First thing we do as a social worker, depends on the setting, but most of the time we do a psychosocial assessment. Psychosocial assessment is compressed by social determinants of the health. That's a framework they use. So if you look up online, like at Google, so you can see what's the social determinants of the health. So that's the base of the psychosocial assessment. So everybody follow the social determinants of health and they assess. Then based on the assessment, they set up the care plan or what exactly we have to do with this client, how we can help out this client. And we need to navigate the system. That's all technical words we use here. Navigate means we need to identify what agency can provide childcare, what agency can provide housing, what agency can provide health care. So we identify, sometimes there's a wait time for those agencies, and we have to send out a referral and we need to call them and find out what's the status and is there any way we can expedite the referral in order to get services early or in time. So that's what we need to do, the assessment. Then based on the assessment, we find out the areas social worker can get involved. Then if need a referral, we'll complete. Sometime medical endorsement needed, so we sit with the medical team and complete those areas. And we reach out to the partner or the agency, support that specific need, and we work with them. Can you go to the next slide? In a nutshell, it's a client-centered practice. And these are some of the areas social workers primarily work. As per the Canadian standard, they developed various settings in order to get exclusive services for families or children or other mental health patients or developmental disability clients or palliative patients or patients with or the individuals undergone any domestic violence or other matters. So it's well defined, the area they work. It's a little bit different from Indian practice. But these are some of the settings I outline it. Family service agency. So they provide children and family services, primarily counseling support and various programs and services to help out the mothers and children and the families. So including individual counseling, family counseling, childhood trauma, referrals or linkages or preventing any domestic violence or abuse, extending referral to legal services, those areas. And when we look into the second agency, Children's Aid Agency, is primarily child protection. Maybe you heard about that, the newspaper, or this children died in UK or Canada due to abuse or neglect. So those kind of scenario, basically the Children's Aid agencies investigate. They work along with the police and court and other agencies, and they investigate and they put a surveillance system on this child to prevent any kind of further abuse or neglect. Because in Western standards, sometimes it will be a single family, and also sometimes it's a joint custody. So they fight for the child. So a lot of legal complications. So in that way, that sometimes it's very risky for the child of health and well-being. That's why the child care agencies, the child protection agencies get involved, and they do the home visits. They assess the child, and they always keep them in a loop in order to prevent any risk or harm, or avoid the scenarios of murder or death or killing. So they keep them in a loop. So in child protection agencies, 99% of the employees are social workers, because it's a social work dominant profession in child protection. And a lot of social workers, Indian social workers, work in child protection Canada. And hospitals, that's the other major area, hospital social work. I'm a hospital social worker. I work in a medical social work department. I did my medical and psychiatric social work. That was my specialization when I did my course. But then again, I specialized in medical social work. I have knowledge in mental health because we need to follow the regulations or policies, and also we need to have the capacity to assess the mental health patients. But I don't really practice, like, for example, like cognitive behavioral therapy or DBT or other therapies. I don't do any therapies. Instead, I focus more on medical social work. That will be health education, patient education, referrals or linkages, or individual counseling, family counseling. And there's a lot of government benefits available. So we have to identify and help these patients in order to successfully transition to the home, in order to prevent any setback or coming back to the hospital. Okay, so I look into more medical aspects. In that terms, I will explain more. That I included a slide, my roles and responsibilities. And also, if you can go to previous slide, I think most of them view this. School boards and correctional institutions, jail and other institutions, social workers very much involved, and welfare administration agencies. So this is a welfare country. Canada is a welfare country. Government give a lot of benefits to the families and individuals. So individuals with a disability, and also the family, they give child benefits. So if you have a child and you are a low income person, government will give you a lot of money to monthly survival. So those welfare administration agencies, there's a huge scope for social workers. They can pick up employment over there. And also federal and provincial departments. There's a lot of social workers involved in that departments as well. Community healthcare centers, they have in between hospital and family doctor. That's the system. So we all have a family doctor. Before you go to hospital, the system is you have to go and see your family doctor first. And the family doctor is unable to resolve that healthcare concern, and if it is a life-threatening or other infection or other matters need further investigation, then they will redirect you to hospital. So this is a strategy the government is adapted to prevent overflow to the hospital. So in between they set up family practice. So we go to the family practice. But recently they developed community health centers as well, because here healthcare is free. You don't have to pay. It's covered. It's taxpayers' money they use for healthcare. But there's a lot of no status people here, and also there's a lot of people with no family practice because there's a shortage of family doctors. So those people goes to even community healthcare centers. They have more staff, and also social workers very much involved in community health centers, helping out mental health aspects or unwanted pregnancy matters, or child care, or individual counseling, family counseling, housing matters, and mental health and addiction. So various areas, social workers involved in community health care centers as well. They are very specialized and they do have education in that aspect to navigate the system. And mental health services are very big organizations like Canadian Mental Health Association, Center for Addiction and Mental Health. Likewise, there are very big organizations. They support inpatient and outpatient mental health services. So there's a huge scope for social workers to get employed in those agencies. And there are many other social service agencies, government departments. So here, as I mentioned, home healthcare is free. It's covered by the government. You don't have to pay anything. If you are a permanent resident or a citizen of this country, so you get healthcare free. So you'll have a card. Whenever you go to hospital or any healthcare facility, you just show the card. It's a health card. Then you get the services. Likewise, there are many other government departments. For example, a palliative care patient or a bedridden patient. That patient needs some home care, somebody to come and look after the personal care need, or toileting or dressing, or sometimes feeding. Sometimes the person has oxygen supplement or a feeding tube, or sometimes this person needs some help with wound care. So government allocate the staff to go and treat those patients in home. So that's also covered by the government. So those agencies called home and community care or home care. That home care agency hire a lot of social workers to do the intake, those who need the services, assess them, and allocate the services and do the home visit. So there's a huge scope for social workers even to get involved in government job, especially in home care. And also there are social housing departments available. Like if you're a low income person, if you're not making much money, and if you are a disabled or a senior person, those people, they can apply for the low income housing. So that's also managed by a lot of employment opportunities in housing department too. And other sector you may know very familiar is about a long-term care home or a nursing home, where the seniors go and stay in a place where they can get all the care, like food or medicine or treatment or their laundry or the stay, accommodation, food, and all the care needs will be addressed in those facilities. It's called a long-term care home, or other name is nursing home. Okay, there are private and also the government homes. In both homes, there's a huge scope for social workers, so they involve. And other areas, employee assistance program. We have insurance through our employer, so we can hire social workers, provide counseling support, or to fill a form or any other aspects. We can hire the social workers. So employee assistance programs also available, and social workers largely employed in those areas as well. And private practice. A lot of social workers do private practice in Canada. They can open up their own clinic, but there are some regulations in place. You need to have the license to practice, and also if you're opening up a counseling firm, like provide a therapeutic counseling, you have to register with the regulatory bodies, okay? Because there's a lot of compliances issues and regulatory matters. So you have to basically follow the Ontario College of Social Work and Social Service Workers policy, okay? I don't know, in India, we have a regulatory body. I think IASPSW, right? Is that the regulatory body, or is that the registration we can take it? Is there a regulatory body in India?
No, sir. We just have associations present. The work is still in progress.
I see, yeah. Was part of the IASPSW, right? Indian Association of Psychiatric Social Workers. Is that the association well known in India?
Yeah, that is one such. For practicing clinical social work, we do have, I think RCI is the body which provides a license for practicing. But then otherwise, for social work practice, we don't have any such body present.
I see. Yeah. So we have two bodies in Canada. So I'll talk about that in coming slides. You can go to next slide. So you can share this slide with your team. That's not a problem. So as a social worker, we can provide one-on-one services. That depends on the agency. or you can work as a part of a multidisciplinary team. So I work as a part of a multidisciplinary team in a hospital setting, in doctors, nurses, nurse practitioners, pharmacists, dietitian, and many other disciplines on board. We work together, and we do assessments, and we do a care plan. Based on the care plan, we support the clients. And likewise, I mentioned child welfare agencies. So they investigate cases on family violence, child abuse, neglect, and take protective actions as required. So likewise, school boards. So the students with the little IQ or behavioral issues, and those students need help in the school, and also the parents need some help about education, how to handle the behavioral issues, how to train these low IQ kids like developmental disability or autism, and deal with problems like aggressive behaviors or other family matters. So school social workers get involved. There's a huge scope for social workers to practice in school setting. And psychiatric social work areas, primarily, there's a lot of inpatient and outpatient mental health setting. They do the assessment, and they do the treatment, and they do the rehabilitation, and they provide a continuation of care following up in the community by providing therapeutic counseling, CBT or DBT or other models of care. And many other community agencies provide all the way to counseling and therapy, referral, linkages, navigation, support, healthcare, and many other areas. Social workers widely employed in all these areas. Okay, you can go to next slide. Likewise, in correctional setting, the social workers are more involved in the correctional setting as well. Parole officers help ex-prisoners to adjust their life in the community, because once they're out, they need a lot of adjustments to getting into the gang or violence or again. So they need to do a lot of adjustments to in order to get receptive or integrate into the community after coming off the jail term. And as I mentioned, social workers also do private practice, and some other social workers are very much involved in policy analysis or policy development. They also work with the regulatory bodies and also the government, health department and social service departments. Their role is primarily give the feedbacks and help the government and regulatory bodies to make policy development, and also review the existing policy to adjust with the context. And also a lot of research program going on, a lot of opportunity in research programs as well for social workers. All right, so this is the first regulatory body I just want to touch or briefly introduce. It's called the Canadian Association of Social Workers. This is a gatekeeping organization. Okay, so for example, you are an internationally graduated social worker. You did your master's, one of the school in India, like your department, and you're planning to come to Canada. So this is a gatekeeping organization. It's called the Canadian Association of Social Workers. So the first step to migrate to Canada or come over to work and have a professional improvement, you have to send all your documents, your master's, your papers from Bachelor of Social Work or Master's in Social Work, your transcript, your syllabus, and also your field placement information, and your work experience and your thesis. Everything sent over to the Canadian Association of Social Workers. So you can send it online. What they do basically, they assess your credentials, your master's, the curriculum and all those aspects, and how many hours of placement you have completed. There is regulatory information about placement. I think 780 hours you have to complete. Otherwise, you're not eligible to get the equivalency. So this is the agency do equivalency. If you send your documents over to this Canadian Association of Social Workers, it's called a CASW. They will check whether you meet Canadian standards of social work based on the information you provided. So that includes everything: transcript, syllabus, all your mark lists, and also the placement information, certificate from the placement, and hours completion, and your employment details. So send everything over to this CSW. They evaluate, and they will give you the feedback. When I did in 2006, they said, yeah, your education, master's in social work, equivalent to the Canadian standard. So they give me the equivalency. So if you don't receive the equivalency, there is no way to come over. It's very difficult. So first thing, you need to learn about the CASW guidelines. And if anybody planning to come over to Canada, you have to comply with the CASW requirements. So send all the documents over to CASW and they assess and they will give you a certificate. Your credentials are equivalent to Canadian standards. That's the document we need in order to apply for any permanent residency application to Canada. Okay, that's the first step, but there's one more step to complete. You can go to next step, next slide. So the next step after getting the CASW credential evaluation, they say, okay, your master's in social work equal to Canadian standards. So you'll get the certificate. Okay, so equivalency certificate. Once you have the equivalency certificate, then the next step, basically you have to apply employment, or you have to apply for permanent residency not to come to Canada. Because it's a regulated profession, it's very hard to get a social work job directly being in India, because Canada is not doing any direct recruitments. Because you need to have the license to practice. In order to have the license, you have to be a permanent resident of this country. You cannot get the license being in India. Okay, it's very tricky because CASW is a regulatory body. You can have the assessment done, you can get the equivalency. But to practice in Canada, based on the equivalency certificate, you have to obtain the license, whichever province you are. So you have to, for example, I'm in Ontario, so I get the license from Ontario College of Social Work. Okay, so in order to get the license, you have to have the legal status to live in Canada. That's a permanent residency, or you have to be a citizen. Okay, if you are, you can come for study, and you can be on a work permit, but you don't get the full license to practice. You can take the provisional license only. So that provisional license is not enough to practice. If you use your provisional license to practice, then it's illegal. Okay. So you cannot do that. And that's the next step. So after getting your equivalency assessment, then your next step is check the immigration website and see whether Canada is hiring social workers. If they're hiring social workers, then that's your call. You can directly apply using the government website for permanent residency. Then you follow the government instructions, comply with all their paperwork, and come over to Canada. Once you landed here as a permanent resident, that's the first step. Then immediately you can get your license because you already completed eligibility as equivalency assessment. Then you can get the license. But if you are not here in Canada and if you're not a licensed or permanent resident, then you cannot get it. Okay, so there are some restrictions in place. That's why it's very tricky not to come. You cannot, there is no direct hiring, or you cannot apply any job from India and get the job and come over because it's a regulated profession. There's a little tricky, but only way to come over to study or apply for a permanent residency. Okay. So in order to come as a permanent resident, first step, assessing your evaluation with the Canadian Association of Social Work. Second step, after landing in Canada, any provinces, for example, Ontario province, as soon as you land here, you have a local address, then you send all your documents to Ontario College, the evaluation certificate to the college, and college will issue the certificate or the license. Once you have the license, then you can apply job in anywhere. Based on your expertise, you can apply. And those are some of the agencies I mentioned earlier. These are the agencies you can practice. For example, some are very good with, there is no specialization here in human relations or community development or women empowerment. Yes, there's a lot of agencies work for women empowerment, preventing domestic violence or violence against women, and providing support for single parents or the women on street, so homeless. There's a lot of opportunity in that line, but there is no industry relations or human resource or other specialty here. Medical and psychiatry, yes, of course, you can branch out to either medical or psychiatry based on, and women empowerment, of course, you can do, okay? Can go to next step. Yeah, this is about the college. So if you are living in Ontario province, then you have to get the license from Ontario College. And as I mentioned, you need first step CSW credential evaluation. Second step, you need to be a permanent resident to get the license to practice. Okay. And we can go to next slide. Yeah, it's basically the college objectives. It's similar to our social work practice. You can go to next slide. Yeah, so scope of social work practice is well defined, and the principles. And when we practice social work, some of the keywords you have to understand before you engage with any client or any psychosocial assessment or intake. The first step is getting the consent from the patient. Okay, whoever is a service user, we have to ask the consent, and there are some regulatory or policy in place, and it must be very specific. For example, when I do the intake or when I get a new referral and I do the intake with social work or client, then I need to ask, I need your consent under the Privacy Act. That's Ontario province. I have a Privacy Act. Under the Privacy Act, to collect, use, and disclose your personal and health information in order to the assessment, treatment, and in order to set up the services to coordinate with the partners in the circle of care. I need to ask very specifically. And if patients say no, then I cannot do any social work assessment. I'm done. If patient declined the consent, without the consent, even I cannot speak with the client or do the assessment or help the client out. So the first step before we engage anybody, asking the permission or asking the consent from the patient. If in the scenario, patient is not capable due to mental health issues or elderly with the dementia matters or due to brain injury or developmental disability, then there is a policy in place who can be a substitute decision maker. So that's a next of kin, maybe husband or mother or father, or sometimes government allocate a legal guardian. So we look into the documents, who is the next of kin, and we speak with them and obtain the consent. Okay. So it's very standardized process, but if client decline the consent, there is no way to provide any kind of care. Then we say, unfortunately, I'm unable to provide any care or support to you because you declined the consent, but you can come back to me whenever you feel free to give me the consent. So that's what it is. And even I mentioned the consent part. Okay, the client consent. Oh, of course, yes, you have my consent, proceed. Then I ask again, any consent restrictions? Are you okay in case your father or mother or child or wife ask you some information? Is that okay to provide? Most of them say yes, but some of them say no. If it is no, then I have to record it. Patient provided consent for social work consultation, but no consent to disclose any information with any partners or spouse or any other agency. So we consent restrictions we put in place, okay? And everybody follow the same consent restrictions in place. Then we do the assessment. There's a psychosocial assessment, as I mentioned, is based on social determinants of the health, or sometimes it depends on the setting, mental health setting or hospital setting or correctional setting or child welfare setting. Sometimes it will be a modified version, but the base is social determinants of the health. And the third thing, keywords we use, privacy and confidentiality. So as I mentioned, we cannot disclose any information to anybody, even our family member coming and out, what happened to this lady? So we are not supposed to express anything. So we just say it's basically client-centered. We don't take anything outside the office. So we keep it everything there and go home, but we don't discuss or disclose to anybody because confidentiality is a primary concern. And that's one of the policy we need to follow, privacy and confidentiality. We are bound by that. We cannot disclose any information to anybody without consent. Okay, within the team, yes, if we are working part of a multidisciplinary team, doctors or nurses or allied health, yes, of course we can do, but outside, no, we need to get the consent in order to do it. And also we have to do the documentation, and we have our standards in order to document it. So when we work in a hospital setting, we follow a model called FDAIC, A-R-E. F means focus. So what's all about this? A social work assessment or psychosocial assessment. Data, what we do basically, it's a format given by the hospital and is standardized. So we just a little bit write about their background, why this referral came to social work, what's the reason, and what's the basic information. And action, there's focus, data, and action. What action you take? Did you provide any individual counseling or a referral or linkages? Or did you refer this patient to home care or any other resources, mental health department or legal support? So what action you have taken? And what's the response from the patient? So whether the patient is happy or still fighting or any other matter, so we need document and evaluation. So whether this patient need a continuation of care or all the social work interventions completed and are you closing the file. So we basically follow the very simple format that focus, data, action, response, and evaluation. That's a standardized template for my practice, and most of them practice in the similar way, but every organization have different standards. They have their own templates. And also we have to follow all the available legislation and policies. Okay, you can go to next step. And the last agency is called the Canadian Association for Social Work Education. So this body is responsible for accrediting university-based social work programs. They look into the curriculums and they revise it periodically. So when I was in India in 2004-06, we all feel that our curriculum is outdated. So this is very outdated. So that was even I was a student, but I can feel it because I'm not gaining much. When I started to do my placement, I did my placement in National Institute of Mental Health and Neuroscience, Bangalore, NIMHANS, Bangalore. And also I did in St. John's Medical College, Bangalore. I did also the APSA, Association for Promoting Social Action. So leading organization. So when we do the placement, our knowledge is very limited. We are theoretically, we are very poor. But we recommended that time onwards, no, we have to update our curriculum. For example, the students picking up the medical social work, they have no background about at least medical conditions or all those information. And psychiatric social work, they do the basics. Then you can get field placement and get some practical knowledge. But our curriculum is not up to date in order to get more knowledge. So that's one of this body basically periodically revise and they up to date based on the current needs and practice. And that's why this Canadian Association of Social Work Education body is very important. You can go to next step. So as I mentioned, it's not complicated, but we need to follow the legislations. If you work as a social worker in Canada, so we cannot bypass or we cannot do anything. It's very strictly we need to follow. And we have to follow the legal and ethical routes. And also we need to follow the Social Work and Social Service Workers Act. Some of the major legislations, Healthcare Consent Act. That's what I mentioned. Before you provide any care, medical or social or any care, we need to get the consent. That's primary. Without consent, you cannot even provide any care. For example, if doctor prescribe a medication related to mental health or a medical condition, so patient have the right to decline. So we have no way force the patient to take this medicine. If patient say, I'm not going to take it, that's it. That's your right to deny or take it. So we have no right to. That's why the Healthcare Consent Act is in place and the individuality in place. If they say, no, I don't need any service or I'm not going to give you the consent or I don't need this medicine, that's it. So we cannot force. Unless that person is very high risk for self-harm or suicide or some other matters, social issues and causing harm to others, then we can go to court and we can get the order from the court. Then we can forcefully administer it. That's more happening in mental health patients, those who are non-compliances, but at the same time, self-harm or have that behavior to harm others. So only exceptional scenario, but general scenario, if you say, I don't want this medicine, that's it. That's your choice. You don't have to take it or no treatment or no, you have the right, okay? And secondly, I mentioned about Substitute Decision Makers Act. If the person is incapacitated cognitively or mentally or no memory, unable to make the daily decisions. So in that scenario, next of the kin, a family member can be a substitute decision maker. And if it is a document available, we'll follow the document. Sometime this person, elderly person, It's called the power of attorney for personal care. And also there is a power of attorney for finances. So who can handle the finances and who can make personal care decisions. So if there's a written document in place, so we follow that document, who is assigned in that document. So anybody can be a power of attorney or a substitute decision maker, not only the family, friend or neighbor or anybody. So we follow them. But if family come in, oh, I'm the substitute decision maker, though we don't allow. We allow as per the document. If the document is not available, then we follow the next of the kin. Okay. And also Personal and Health Information Protection Act. So as I mentioned, we are unable to provide any information to the family or other people if there's a consent restrictions in place. Only if the patient consent, we can disclose. Okay. And other Child, Youth and Family Services Act and Mental Health Act. These are some of the main act we follow. You can go to next step. Okay, so yeah, this is a consent act. You can get more details from here. You can go to next slide. Substitute Decision Makers Act, because it's not really applicable, but I just want to, if anyone like to refer it, so you can use it. Go to next slide. Personal Health Information and Protection Act, what's all about it. Go to next one. Mental Health Act, so you can get the information. So you can see the difference between the social work practice in India and Canada, referring this act and privacy policies. Go to next slide. And Child and Youth Family Services Act. This is also a very interesting fact. How you deliver the services to child and family. Go to next slide. Yeah, go to next one. Social Work and Social Services Act. And yeah, so those are some of the policies and acts in place. We need to follow everything and we have to self-educate, or the organization you work for, they will give you the education because we need to follow, because the clients, Canadians, right? So the citizens, they're well aware about their rights. So if you don't know, that is very hard to practice. So, but they give education all the time. Oh, this is what it is. They give the best practices, policy information, and the act, they will educate us. And while working, we can learn and move on. And you can go to next slide. Yeah, some of the major skills social workers needed is assessment skill, good communication, critical thinking. You have to be teamwork, and emotional intelligence and listening skills, documentation, counseling and therapeutic, basic things. So this is applicable to Indian context as well. So we follow the same. Go to next slide. Yeah, it's a little bit about what I do as a medical social worker in a hospital setting. I work in a department called complex medicine. Okay, this is a department, it's a learning site. We do the integrated care over this clinic. We see the patients with the multiple health issues, chronic health issues, congestive heart failure, diabetes, hypertension, COPD, asthma, kidney disease, liver disease, and many other conditions. So this is an all-in-one clinic. And this is a case management program, means we have over 250 patients on caseload. They will remain for 6 months to 1 year time. In that window, whatever non-medical aspect, psychosocial needs or homelessness, home care needs, any equipments or oxygen supplement or any funding or any legal matters or any safety concerns, or they need some transition to a long-term care home, or they need some exercise at home, or kind of fall risks, all those matters, as a social worker, I have to assess. Okay. And I have a psychosocial assessment form available. It's a 10-page form. I have to complete. Everything is based on the social determinants of the health. That form, I can maybe do one more session. It's very interesting form. And it may take 1 hour to explain. That's the biggest form. But once you learn the psychosocial assessment form, it's very easy. You can understand how to handle a patient. So the first step as a social worker I do in this complex medicine is a part of a multidisciplinary team. Internal medicine doctors, specialty doctors are there, 4 of them. Nurse practitioner are there, nurses, registered nurses, pharmacists, dietitians, social work, and other exercise therapists and admin. So I work as a part of the team, and it's a case management up to 1 year. But I work other clinic as well, but in and out. Some emergency departments, they call me for a consultation, but it's only one time. Just go, do the immediate things and close the file and come back. But the medicine clinic, it's a longer term case management program. I am responsible for the patient until the client get discharged from my caseload. And first step, I do a comprehensive psychosocial assessment. The form is given by the organization. And based on that, I identify the areas to provide the care and support. Sometimes patient need legal help. Sometimes patient need home care, equipments, or housing, many, and also application to welfare programs or mental health services. So based on the assessment, I initiate, and also I do provide individual and family counseling. Sometimes the patient and family in education, because it's a medicine unit and we get a lot of liver cirrhosis patients. So we need to educate on alcohol abuse. We need to educate on impact on many other areas. And sometimes we get domestic violence, elder abuse patients. So we need to educate on their rights. Okay. So likewise, we'll do, and also congestive heart failure patients or COPD patients, we need to do the education on that aspects. Case management is integrated, and we need to learn a lot of community resources in order to send safely back to their home. So we have to understand all the available resources, and we need to initiate referral linkages. And also system navigation and care coordination. It's a term they use because there are a lot of agencies around provide various kind of support. So we work with all those agencies. So we need to send appropriate referrals or connect with them to get right care and support. And also sometimes there's a huge wait time, but this patient is very critical. We need an early bed in a palliative care or in a nursing home. So some crisis situation. So we need to crisis intervention. Then we liaise with those agencies to expedite the application and get the bed in time. And sometimes we get patients, they have no idea what exactly their choice or options. Then we do psychosocial assessment, but it's a generalized version. It's called a global assessment. So we ask everything and we figure it out and go. Okay, you can go to next slide. That's the last slide, I believe. So as a social worker, what I do in a hospital medical setting. So as I mentioned, I do the psychosocial assessment, and also these are some of the resources available for them. Most of the services are funded by government, but some are not funded. So what they do basically for information referral to community support services, a lot of agencies provide healthcare services and meal delivery programs, sometimes behavioral, the seniors with the dementia, if they exhibit behaviors, or the autism or developmental disability, if they exhibit behaviors, or other mental health and addiction patients exhibit behaviors, self-harm or harming others, or other violent behaviors or suspiciousness, or active or passive suicidal thoughts, those kind of things. So we need to send referrals to appropriate agencies. So we have to know what agency is appropriate for them. And also we initiate the referral. At the same time, rehabilitation, motor vehicle accident victims, patients after post-fall or fracture. So there are stroke patients after the stroke where they go to get we identify the areas, what are the agencies provide the care and support, and also legal services. Some patients need legal care, prevent elder abuse, domestic violence, and some other matters. So we refer to the legal service. And even here, the medicines are covered. So most of them get medicines covered as well. Below 21 years old, get free medicine. And after 65 years old, government give free medicine. Okay. And also those who are on disability, government give free medicine. But we have to do applications for specialty medicines and all those. So as a social worker, I have to do all these applications. And home care services, if anybody need any home care, we initiate, and sometimes patient can't go out, they're bed bound or palliative, so we need to send out a doctor to them. A social worker get involved. And addiction and mental health, we navigate to appropriate services and initiate referral and send them out. Sometimes we have to call the crisis line and report this patient is having active suicidal thoughts and need immediate intervention. So once they expressed, I'm having suicidal thoughts. So that also as a social worker I have to do. And counseling services, individual family, and also sometimes they need a housing support like emergency shelter or transitional housing or long-term care home. Those kind of things we navigate as well. Sometimes they need equipments, wheelchair or walker or oxygen supplement or hearing aid or other matters. So I have to get involved. Anything non-medical coming in a healthcare spectrum in medical department, I'm in charge to do it, including transportation, because sometimes patients need a wheelchair transit. They are unable to walk, they are wheelchair bound. So they need a wheelchair transit accessible vehicle. So I have to do the application for them. And sometimes they need to get funding from the government for living allowances or housing support or meals or medication or nutrition supplements. So I will do the application again. And this is some of the glimpse, but this is, this much I can put it in a flare, that's it. But when we practice, everything is coming to us. Any non-medical aspects, we have to get involved and we need to figure it out, work and help them and safely reintegrate them into the community. Okay, so that's it about it. You can close the slide and I'll just brief about the practice wise. As I mentioned, there's a huge scope for social workers in Canada. Okay, so you can come over. It's very well reputed. And the first step, you have to complete your master's or bachelor's in social work, and you do the credential evaluation, get the equivalency, then work a couple of years in India, gain the experience, and also watch out the immigration website. There's a website, I can share the link as well. If they are hiring social workers, okay, then you can apply. Once you're here in Canada as a permanent resident, you can get the license to practice as a social worker. So you have the license, you can apply job in anywhere. And some of them face difficulty to get job initially. So what the best practice here, they do volunteering. So whoever coming new to this country, they do volunteering. And that's the best way to get knowledge about the policies, act, and also get Canadian work experience, okay? And even in order to qualify for the permanent residency application, you have to have certain years of work experience, and also you have to have IELTS, the English Language Eligibility Test, and you need to qualify certain score in order to meet the criteria. Okay, that's one of the thing, and that's why I got the orientation when I completed my graduation from Bangalore University. So Dr. Gandhi Dos, I think some of you know Dr. Gandhi Dos. He used to be my professor. He said, yeah, if you have any international plans, then do some volunteering. That can give you a lot of opportunity. So I did my volunteering almost 8 years with the National Federation of Blind. It was beautiful experience I had. Then I picked up an international opportunity. It's called Cultural Youth Exchange Program. I went to UK. That was a stepping stone getting into the Canada. That's my first international experience being a social worker. And you can also look into, there are various opportunities available for cultural exchange program. If you need any link or agency I've been through, I can definitely provide. That made me to land in Canada because I did a lot of volunteering. I learned all those various spectrum. Networking is a key. So you met a lot of people, and volunteering, it's a noble thing you do. And I got a lot of connections and contacts and very good friendships, and they give me a lot of opportunity. And that's why I got this wonderful opportunity to go to UK. I did my placement or the residential volunteering and learning support assistance, and I learned a lot of social work aspects in UK. Then I decided to migrate to Canada. But if I didn't went to UK, sometime I will be continuing in India. But those who are looking for international social work career, look into the global opportunities. Even you can go to any country, UK, Europe, or US, or Canada, anywhere for as a volunteer. Do it 6 months to 1 year time. That will give you a good boost to your profession. You can improve your language. You can learn the international standards, and you can have a lot of key people identified, and you can grab the international opportunity as well. Not only in coming to Canada, but many other countries on international project, United Nations or development law agencies, UNESCO, and other areas as well. So experience was good when I picked up first international opportunity, went to UK, and I landed here. So I'm so happy to share the knowledge, and also if anybody willing to come over, please. Okay, so you can reach out to me. I'm so happy to guide in that way. Any regulatory affairs or any licensing affairs or career prospects or giving more information about any of this. And also the volunteering opportunities or agencies, I know we can widely share the resources. And any questions? I'm done with my presentation. I know it's a little theoretical. It's not really QA session kind of, but I'm open if you have time. Otherwise, you can send me the questions. I'm so happy to respond to you, okay?
Thank you so much, sir, for your inspiring and insightful talk, where you shared your professional journey. You focused on licensing procedure, degree programs in Canada, practice differences from there, Canada and here in India, major areas of employment for social workers, which is very vast in Canada, including the opportunities of volunteering. The framework FDARE followed there in Canada, the Canadian practice. Curriculum revision and updation, the major legislations governing social work practice in Canada. You also discussed the key terms and skills that one should know to practice social work. You emphasized upon the health benefits that the citizens get in Canada, attracting us all there. Your journey and contribution to the field of social work, especially in medical settings, have truly been remarkable. We are certain that your insights have sparked motivation and hope for our aspiring social workers as well. We will now open for question and answers session. And if anybody is having any questions for Mr. Praveen Varki, please feel free to unmute yourself and ask. You can also post it in the chat box.
Good evening, sir.
Yeah, go ahead. I can hear you.
Okay, sir. Very good. Sir, first of all, thank you for your experience and your knowledge. So, sir, I just want to know what is the career or what is the scope of research in Canada, and also what is the procedures to get in PhD in Canada?
So, research programs, they get locally engaged. So you have to be here in Canada in order to get involved in any of the research programs. That's my straight answer. And second thing about PhD, actually, I would say I missed an opportunity to do my PhD when I was in India. It's not easy to do here in Canada. It's very expensive and it's take over 5 to 7 years. And less funding available in order to do. And it's very strict. So it's not easy. I felt many times I missed the opportunity. Just give me 1 second. Just. Yeah, so we can do, yes, it's very, very expensive. When I tried, I couldn't afford it. That's the honest answer. And I regretted I couldn't do that when I was in India. Actually, my professors, both of them, I actually have a UGC net to teach social work. And I used to take sessions for the university students. And my professor said multiple times, you just register it. You only come and teach the students. That's what you do. But I was in a different profession that time. I got nice job when I was in India and I was enjoying with that, and I failed to do my PhD and I regret that. If I did, actually I could have a lot more opportunities. But if you are in India, I would suggest you do from there, and that's the best way to handle. And once you have a PhD, even United Nations or international developmental organizations, they have a lot of opportunity. And I'm missing that opportunity, actually. And I tried to do here in Canada, and it's not easy. It's very expensive and time-taking, and while working full-time, it's not easy to do. Okay, so any other questions?
Yes, any other questions? If participants have the question, please unmute yourself and ask. You can also post in the chat box.
Sir, is there in India we have methods of social work like work, social group work, community organization? So in Canada also these methods are relevant, and they teach these methods there in the syllabus?
Yes, they do. That's a very good question. That practice primarily I see in hospital settings and outside mental health settings. Addiction and mental health setting, they do this group therapies more or less. But in hospital setting and also many setting is individualized. We do the casework. Casework is the key, but additional mental health setting and some other residential setting, for example, the nursing home or the retirement home, or there's a community living. It's called, the youth with developmental disability matters. Those agencies, they do the group therapies. So we all social workers, absolutely, they practice, and as per the curriculum, they have to go and learn all this. And also they run specialty groups for the seniors. It's called a seniors day program. That's also group therapeutic programs. So we have to have that skill and knowledge set in order to handle those groups. Social workers are widely employed in the day programs as well. Yes, we do all those aspects here. All three. Yes.
Thank you, sir.
Any further questions?
One question is there in the chat box regarding volunteer platform.
I see. Yeah, so you can do, I didn't see the question, but I can generally explain. I did my volunteering through an agency called ICDE India, Intercultural Dialogue and Exchange India. They're a Bangalore-based organization. I think still they're doing placement to European countries, not to US or Canada. And they are connected with ICY, Intercultural Youth Exchange Program, and based in Germany. There's a lot of opportunity if you explore through ICDE India or ICYE. That's the agency I did my placement, my volunteering services, if you are looking for an international opportunity. But that time I paid myself for travel tickets and some processing fee and all. But it's very rewarding. It's a great opportunity. So there's a hosting organization. They give us free food and also accommodation, and they will be having a mentor, and they will give us some money for monthly expenses. So they take care of everything. And it's beautiful programs if you like to apply and try. Also, you can apply volunteering, virtual volunteering platforms if you are like to apply international agencies. I will explore and send over to you some of the agencies you can apply being in India.
Sir, I also had a question.
Yeah.
Actually, the practice of social work, like I said, we are offering 4 specializations here. And we do have practices in community development as one specialization, and the second in human resource management and labor welfare. Now, if anybody is supposing having a master's with these specializations, do they still get a chance to enter into a place like Canada?
The human resource management is not considered as a social work branch here in my best knowledge, okay? So I didn't see anybody with that specialization got credential evaluation done or obtain the license. Sometime they advise you go back and do 780 hours of placement in some of these other areas, not human resource related, other areas of women or medical or mental health, and come back. So otherwise they don't give that equivalency, because medical social work is considered as social work here. They have no 4 specializations. They do have various specializations. They can pick it up when they do placement. When you do the placement, you can go to child protection, you can go to mental health, you can go to hospital, you can go to seniors care, you can go to palliative, you can go to any sector when you do the placement, but no such specialization here, community development or women or medical and psychiatric social work or human resource. So it will be a different platform. They oversee the courses here. But with the human answer to the question, in my best knowledge, that is not recognized.
What about the practices? Say there are certain human resources functions which I believe would be there in the healthcare settings as well. Say you have to recruit somebody or the other HR functions. So who is supposed to carry them? Like in the morning, we were having a session from a lady from Australia, and she emphasized upon the HR functions. They are actually carried on by the people having knowledge and experience in the HR sector. So is there any such thing in Canada?
Yeah, so they can do must MBA or other human resources. There are a lot of specialized courses, office administration and business management, hundreds of courses available, and they're specialized in that. When you look into the competency perspective, they don't choose social workers to be in that role.
Okay.
So social workers, they are more looking into working with the patients and individuals. If you have any experience dealing with the patients with any of the spectrum, mental health or addiction or family violence or child protection, hospital social work or individual counseling, family counseling, they are not looking into a human resource perspective, working with other spectrum of the services. But in India, there's a huge scope because you can branch out. But here they consider social work is basically working with individuals and families. There can be any condition, but still they have to be people-centered.
Thank you, sir. We have another question. Stella, Ms. Stella, please proceed with your question.
Hello, sir. Thank you, sir, for this informative session. Actually, my question is like you informed that after we upload all our documents and everything in the Canadian Association for getting the license. So after that, when we are coming there or after we get the PR, you told like we need to register in the School of Social Works for the license. So is there any licensing exam or is it directly? Because in US and all, we can see LMSW and separate states have different exams also. So, and you told in Ontario that if we get the license, you can only work there, right? Or we can work in different. So I just want to know about that.
It's a very great question. So first of all, CSW is a regulatory body, assess your equivalency, okay? So if your credentials are equivalent to the Canadian standards, they will give you a certificate. Then that certificate you can use to apply when you do your permanent residency application, because you are applying in the social work domain to social worker to Canada, so as a permanent resident. So this credential evaluation is required, okay? So that document is required. Then you can apply for permanent residency. And once you approved for permanent residency, landed in Canada, then immediately, if you're coming to Ontario province, then you reach out to the Ontario College of Social Work and send these documents. I'm a permanent resident and I have the equivalency certificate from CASW. Then they will give you the license. There is no exam in Ontario province, only the Ontario province. That's why most of them coming to the Ontario province. But there are many other provinces in Canada, Alberta or British Columbia or some other provinces, they have exams and their regulatory compliance are very high. That's why it's very tough for a newcomer to qualify the entrance exam. That's why everybody coming to Ontario province, they get the license and they work 1 or 2 years. Then they move out to other provinces because they can transfer their license into that particular provinces. So luckily, so far, there is no licensing exam in Ontario province. I heard it's coming, but so far not implemented. So social workers are lucky to have that privilege. But other provinces, they have very strict exam. And also, they have to go and work under a registered social worker for how many hours? I don't know, 300, 400 hours in order to get the license. There are very strict criteria in other provinces, like states. States, in order to get license, you need to go the exams, you qualify, then also you have to work under a registered social worker. But in Canada, Ontario province, no such regulations. We are lucky to have that, but I heard it's coming, but so far not implemented.
Thank you, sir. Also, sir, you mentioned about the work experience for the license, no? So is it the work experience only in the field they're asking for?
Yes, if you work in other spectrum, in human resource or any other area, it's not really considered. So you need to have experience in social work, working with individuals or family, any domain, mental health or addiction or child welfare or school or whatever domain you work, hospital or any setting, but it must be a social work related. You can work with women and children or HIV or cancer patients, or you can work with the street children or slums or anywhere, but still it must be outlined in respect to social work practice.
Okay, sir. Thank you.
You're welcome.
Any further questions? Thank you all for your active participation. On behalf of BSSS, we would like to extend our heartfelt thanks to Mr. Praveen Baki for his time and for sharing his incredible experiences with us today. Ladies and gentlemen, as we come to the close of today's enlightening and inspiring international webinar on career prospects in social work, I'd like to take a moment to reflect on the key takeaways and express my heartfelt gratitude to everyone involved. We have had the privilege to hearing from two exceptional professionals in the field of social work, Ms. Akansha Nagesh Subramaniam and Mr. Praveen Varki. Their insights into global career opportunities, especially in human resource management and medical social work, have provided us with valuable knowledge and a fresh perspective on the international avenues available for social workers. Their personal journeys and achievements have truly shown us how impactful this profession can be on a global scale. This webinar emphasized the importance of passion, dedication, and a sense of service that drives success in this field and made us aware of the diverse career paths that lie ahead of us. From understanding the crucial role of social workers in healthcare to exploring how HR skills can be applied across industries globally, today's session has been incredibly enriching. I hope this webinar has inspired you to dream bigger and think globally as you plan your careers. Social work is a profession that transcends borders, and your skills are needed worldwide, now more than ever. Whether you choose to specialize in human resource management, medical social work, community development, or child welfare, the possibilities are endless if you stay committed to learning and growth. Now, let me take this opportunity to thank the college management, particularly Dr. Father John PJ, Principal of BSSS, Dr. Sister Sonia Kurian, Vice Principal of BSSS, and Father Chomi Panathas, Dean of Academics, for always inspiring and guiding us in such ventures. I thank my team, Dr. Ritvik Gandhi, HOD Social Work, and Mr. Piyush Porwal for their active involvement in the planning and execution of the webinar, along with all the other department colleagues. I also thank Mr. Eugene for the technical support provided. A huge thank you to all our participants for being such a wonderful audience. Your engagement, attention, and insightful questions have made this webinar a success. Most importantly, I thank God Almighty who made it possible for us to come together using this virtual international webinar to expand our horizons. Thank you once again. The attendance cum feedback form is posted in the Meet chat box. All the participants are requested to fill out the form as it will be useful for us to generate your e-certificates. The certificates shall be issued within a week's time. Till then, I request all the participants to stay connected with us on the WhatsApp group. The information which is shared by Mr. Praveen Varki would be shared with you on the WhatsApp group as well. I wish you all the best in all your future endeavors as social workers. Have a great time ahead. Thank you so much, sir. Thank you all.
Thank you so much. It is such an honor to talk to upcoming social workers, and you can definitely share that information. I sent over to you the PowerPoint presentation or PDF. And if anyone like to more about any help needed, to understand more about immigration pathways, or if anybody coming to Canada and if they need any help, I'm so happy to help them, because I'm a social worker and I like to help our social workers. So by any means, so if you can reach out to me anytime, email, or also if you want to add me to any of these groups, I can, like WhatsApp groups or whatever is needed, you can add me. I'm so happy to contribute in my best ability, sharing the resources available for international volunteering opportunity or practices or any updates, or if you need more resource person exclusively in some of the areas, just feel free to ask. I'm so happy to support.
Thank you
And
so
I wish
much.
you all the best to all the social workers. You are our future leaders and heroes. So you are the agents of social change. So I always admire you took this decision to become a social worker. And I'm so proud about myself. Okay, so be proud.
Thank you so much, sir.
All right, so enjoy your evening. Thank you so much for this opportunity.
Have a great time ahead. Thank
too.
you, sir.
Bye now. Bye for now.
Bye.
Thanks, everyone.
The participants, please fill in the feedback form. This will be used for the generation of e-certificates. Once that is done, you can exit the meet. Have a great time ahead.